So thanks very much. So I know I'm in the sexual health and reproductive health stream, but I am going to talk a little bit broader. So I'm going to talk about how in the Women's Council we're advocating for women's health here in Ireland. And I'm the Women's Health Coordinator in the Women's Council. And because we're under such strict time things, I am going to read to a certain extent because I want to make sure I get through the slides. So just to say, if you don't know the National Women's Council, we're a feminist organisation and we're a membership organisation, and we have 190 member groups across the country. And we were, as Alva said, one of the 3 organisations that led the Together for Yes campaign. And as I said, we're talking about reproductive health here, but in the Women's Council, and in any organisation that works on women's health, we recognise all the different issues that impact on women's health. So that's things like caring, that's the mental health impacts for women, ageing, chronic diseases. All of those issues are issues that we're advocating for women here in Ireland. And in this 7 minutes, what I want to talk about is our bad past in Ireland in terms of women's health. Talk about what's kind of concerning about the present, and then talk at the end about the future and how we do have optimism for the future in terms of a women's health action plan. So starting off with our bad past, I suppose the fact is that Ireland has a litany of scandals that have affected women and women's health. And just some of them would include some physiotomy, the blocking of the mother and child healthcare scheme, the hepatitis C scandal, the hepatitis D scandal, and then the all-out ban on abortion that came into our constitution in 1983. And we're also in the midst of 2 current scandals here in Ireland, and that includes the cervical check controversy, and it also includes the concerns about our new national maternity hospital that we're going to get in Ireland, and whether that will still be under the control of a religious order that in the past ran Magdalene laundries. And in terms of these women's health scandals, we've heard women's testimony about them because, these scandals are not faceless, they're not theoretical events, and they have really terrible consequences for individual women. So if you think about, for example, Bridget McCole, who was a survivor for a time of the hepatitis C blood scandal, but it was only hours before this Donegal woman died that the Blood Transfusion Board actually accepted liability for what had happened to her. We've also heard much more recently the testimony of women through the cervical check controversy about how they were treated within the healthcare system, in our current healthcare system. And that was through the Scally reports into cervical check. And I think it's very poignant that one of the women who was interviewed as part of that actually said, why does this always happen to women? So that sense that there's something about women's health in Ireland that has had a poor response. So I suppose in the Women's Council and within the wider health community, I think we have to take the legacy of these scandals and we have to make sure that in the future the healthcare system in Ireland isn't fettered by a creed or an ideology, and that women are put at the centre of their care, and that women are able to make the best decisions with their doctors about their own care. And I think that's what we're all working towards. So in the Women's Council, as I said, we're a feminist organisation, so that means we want to be explicitly feminist in how we do our women's health work. And I suppose to summarise that means that we think about gender and power as the underlying factors that influence women's health and how women's health is responded to. And I suppose that means we think about the stereotypes that women experience, and we also think about the experiences that women have, maybe in terms of violence, for example, in terms of a disproportionate amount of caring and how that impacts on women's health. And I suppose it's not just us in the feminist community who are saying this. The medical journals are also saying it. So if you look at The Lancet, just a few months ago, there was an article which was decrying the impact of gender inequality on health. And that said, gender inequality and restrictive gender norms are powerful, but they're separate determinants of health and well-being. And because of the historical legacy of gender injustice, the health-related consequences of gender inequality fall most heavily on women, and especially on poorer women. And as I've said, part of this is because women have particular life experiences. Even in Ireland, women are more likely to be poor. Women are more likely to be lone parents. Women are more likely to be doing the majority of caring. And also within our health work, we have to think about it from an intersectional point of view. And that means that we need to address women's health and look at the intersections of identity, of ethnicity, for example, on women's experience of health. And I suppose I just want to recognise that being intersectional is a difficult thing to do. And it's particularly difficult, I suppose, for someone like me working as a women's health coordinator, as a privileged European woman, to think about all the different power imbalances that women can experience. And we would just come back, I suppose, to the initial definition of intersectionality that Kimberly Williams Crenshaw said, when she said that intersectionality draws attention to the invisibilities that exist in feminism. So obviously, it takes a lot of work to consistently challenge ourselves to be attentive to the aspects of power that we do not ourselves experience. So I suppose, how do we look at gender inequality and how it impacts on women? And we understand the most important way to do that is to listen to women when they tell you that they've experienced poor care or they've experienced gender inequality. And the good thing about Ireland is we have a long list of health scandals affecting women, but we also have a long list of women who've spoken out and who challenged the system. So you think about Dr. Kathleen Lynn in 1919, who set up the first hospital for mother and children in Dublin inner city when we had the worst tenements in Europe. But we also think about people like Amanda Mellett, who took her case about having to travel for abortion to the UN Human Rights Committee and had a judgment made against Ireland. And I suppose all of these women tend to have been damaged by the health system, but instead of looking inwards, many of them look outwards and want to make sure that it doesn't happen for other women in the future. And I suppose at the moment, that kind of impulse to change for other women is very well represented by the women on this slide. So that's Lorraine Walsh, the late Laura Brennan, and Vicky Phelan, who've been working tirelessly around making sure that Ireland can be a country that eliminates cervical cancer in the future. And as Vicky Phelan said when she spoke at a Women's Council conference this year, she said, "Leadership in the hands of women is not about creating endless followers, but about sparking change and helping others. When women help other women, we are at our best." So another way, I suppose, in the Women's Council, we feel that we can bring women's experiences and women's lives into healthcare policy is to really recognise that women are the experts about their own health and their own health experiences. And as one example here that you could look at on our website, it's a report we brought out last year called Out of Silence, Women's Mental Health in Their Own Words. And in this, we spoke to 100 women, and they talked to us about how gender inequality and how their just experiences have impact on their mental health and well-being, and also how they go and seek out support in those situations. And, crucially, those women were experts, and they had very good recommendations and calls for change about what they'd like to see change within the system. And then we build that exactly into our policy work going forward. So we're being led by women as experts in their own care. And I suppose this experiential evidence, we think it's very important that policymakers have it and can use it. But we also do see benefits in terms of solidarity for women, because by participating and working together, women can see that it's not just me that's experiencing this. Maybe there's something wider going on, something systemic I need to address. So just in talking to my last slide, just to say, I suppose, all of these ways that we're working, learning from the past, thinking intersectionally, thinking about women as experts, we're building this into the positive future that we do see. So in the National Strategy for Women and Girls, it committed the Department of Health, the HSE and the Women's Council to develop a new Women's Health Action Plan. So this will be really the first health policy that focuses specifically on women's health needs. We are working on it at the moment. We're hoping that it will be developed by the end of the year. We're hoping that it will bring about new structures in terms of dealing with women's health. And crucially for us, we're looking at doing a form of radical listening with women. So that's about us as people who work within the health sector going out to women and getting their expertise built into the implementation and into the plan itself. Thank you.